I'll never forget when I turned 30. I was always a lean, athletic guy. I could eat whatever I want. When I turned 30, one bite of a donut would go straight to my hiney. All of a sudden, whoa, what happened here? It went right from my butt. I noticed it was a huge change. Hello, welcome to the Dr. Gil Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Elizabeth Wilson, our second repeat guest. You were so popular the first time. You're back by what is it called? By demand. People wanted you back, so here you are. So welcome to the show, Elizabeth.
Thank you. Excited to be here.
Elizabeth is a board-certified OBGYN. She's a friend and colleague of mine. We've been across the road from each other, sending patients back and forth for almost 17 years now. Mm-hmm. Elizabeth delivers a lot of babies, does a lot of office GYN, and as I've said in the past, our patients are getting older, and our practices, or at least your practice, more than mine, is evolving to include not only delivering babies and office GYN, but to cover the health and well-being of our patients.
Mm-hmm.
Yeah.
Yeah. I think I was telling you earlier that I feel like I'm only a few steps ahead of my patients at this point. Or well, obviously age-wise, I'm right with a lot of them, but knowledge-wise, I think there's so much going on in the health and wellness space that people could benefit from. And I feel like there's a lot of answers there that I never really saw before when I was just kind of focused on just the newest drug that had come out. And so I've been fortunate to know some people, attend some conferences, and my world has kind of exploded.
Yeah, we're all learning. We're learning so much and learning from each other. The broad topic of today's discussion is metabolism. Mm-hmm. And you had a nice expression for this. You called this root cause medicine. Mm-hmm. What is the underlying health and well-being and hormones and all the things that involve health and wellness that in fact are the root cause of a lot of problems, especially those of what we would call of the modern world?
Exactly. Let's see, how did I come to this? Well, to mention him again, Dr. Trumbauer, who was definitely a mentor of mine when I started out early in practice, he was already there in this mindset. And so I always kind of had, an open mind to that and would learn things from him. And, as a going way back when, I think some of the most profound improvements or health turnarounds that I'd seen had to do with people kind of taking their health into their own hands and doing something different or taking care of themselves. Or, it was rarely a new drug that was invented that made their life so much better.
Right.
And so I had a good friend and I thought I knew a lot about nutrition and hormones, and a friend of mine was being certified. Actually, she'd be a good guest on your show, actually. She practices here in town and online, Adriana McGarity. She owns Crest Health. So she is now a fully certified functional medicine practitioner. And so during her training, she was headed to the hormone module. And she mentioned it to me, and I thought, oh, that's probably a good thing for me. It'll be hormones, and it'll be some nutrition, and I'll go and I'll pick up a few new things. Well, going to that conference just made me see my hormones, or the sex hormones, in a much bigger world of hormones, and the fact that I had been trying to fix things within just a very small space or a limited knowledge. They really laid out something very basic about thyroid hormones and adrenal hormones kind of being almost more, not more important, but potentially bigger than my estrogen and progesterone that I've been dealing with. And understanding that if those weren't working well, nothing would really work well. The other big hormones that I knew a bit about insulin. I think at that time I was starting to understand that polycystic ovarian syndrome had a insulin resistance component to it, so there was some connection there. And then they talked a lot about stress and the hormone cortisol, and how that essentially drives inflammation and drives all other functions in the body, drives how your gut is functioning, the gut microbiome, the brain and the gut are connected. It just was a really kind of world resetting time for me. And so my interest has kind of been in continuing to learn about all those things, because it's all making so much more sense now, even though I don't know the half of it. I don't claim to know the half of it, but it's just enhanced, I think, what I'm able to do.
Yeah, it's so big and so complicated, and it's exciting too for us. It's not boring in the least.
Not at all.
Yeah, we got to keep our eyes open. So let's say, obviously, if you have a person who's feeling great, they're fit, they don't have any problems, they need a birth control pill, they need a checkup or something, then that's an easy visit, and those go by normal standards of care and whatnot. But you and I both, but probably you more, see somebody comes in and says, gee, I'm just gaining weight, I can't explain it, I'm trying to exercise, but I still feel weak, or I'm depressed, or I have brain fog, all these vague issues that can stem from so many different causes, and I think are frustrating for most doctors, because they're not necessarily druggable. You know, they require some insight. So if a woman comes to you with one of these issues, is there a way that you go about assessing someone? For example, after you've done an examination and whatnot, are there typical blood tests that you take that you would use to begin assessing somebody with these vague issues?
Absolutely. Usually what I explain is, well, a lot of times I'll ask people, especially if they're in their 40s, if they have a primary care doctor, or if there's a place where they get blood work done. So I'll sometimes just offer to do blood work if somebody doesn't have that done anywhere else. But certainly the people with complaints, and this has evolved. I basically came home, from some of these conferences and starting to add to the labs that I would check. Not that much, but a more extended thyroid panel. I started checking inflammation levels. I guess, but most importantly, I started looking at labs with, I think, a much more discerning eye on, like, not just what's in the normal range, but what would be essentially optimal. And I think over time, I've also come to realize that with a lot of these labs, that means like having optimal metabolic health, or that their cells are functioning optimally, and that can just affect everything. So I'll explain that I can do some basic labs, kind of the stuff they're used to, and I may do a few other things in there. And now what I do is I kind of go through them. I actually send them their labs, and I write things. And I send it with this cover letter explaining that just because I'm writing all over your labs, it doesn't mean you're sick or that you need a drug. But like, these are the things that might be falling out of optimal range. And, what could this tell us? I may not know for sure. But I had to come up with, various resources that I could send with that, so somebody could read more about what I was pointing out to them.
Yeah. So, I'm going to stop here and back up just a second. I'll make this clear. It is not right to feel foggy or depressed, or to have low energy, or just blame it on just getting older, right? We have this expression in medicine, what are the complaints? Like, somebody comes in bleeding to death. Well, that's a complaint too. It doesn't mean someone is complaining. It's okay to want to feel your best. People think, well, I'm just complaining, or I'm just being high maintenance. It's okay to want to feel great, right? We only have one life, and there's nothing wrong with trying to, even though you're not bleeding to death, or you don't have a tumor growing out the side of your head. It's okay to want to feel good and be your optimum self, right? Right, and to bring these complaints or these issues up to your doctor is not complaining. it is your right. And with somebody with insight like you and some other people on the cutting edge of medicine, it's okay to want to address these things to optimize health.
Mm-hmm.
And one other thing that you just alluded to is that labs, like almost all numbers, are graded on a bell curve. Right? When you cut the lawn, some of the grass blades are long, short, some of them are long, and you have an average height of the grass, right? And so when you say your grass is cut well, you're saying, well, the average height looks good. But there's still some short, there's still some long here. When you measure thyroid, we're going to talk about this more, the most common test that everybody gets, that they've been getting for decades, is this TSH level. And they say, well, normal's between 0.5 and 4.5, right? Well, that's normal, right? But we want optimal, right? So it's really old-fashioned to say, well, your thyroid is normal, because normal includes people who are underactive, people who are overactive. It includes people that are healthy, and it includes people that are sick, right? You don't want to compare yourself to the sick people. You want to compare your thyroid to the healthy people, right? So I just want to make this clear. People are not complaining, and normal is not necessarily optimal. So I just want to make that clear right off the bat. So you see a patient, and let's pretend money's no object, Elizabeth. Let's pretend insurance would pay for everything, or the labs are free, just so we don't have to worry about that aspect of the discussion here. A woman comes to you. What are and she wants everything done. Say, doctor, leave no stone unturned. What are the various blood tests you can get nowadays on this person?
Well, blood tests are covered by insurance more for sure. So that's good. I order a full thyroid panel with thyroid antibodies and a reverse T3.
Okay.
I order the high sensitivity C-reactive protein.
Okay, that for everybody out there is a
and these are actually, I'll tell you, there's things that I do when they're just in the office that I can get to right away. They're usually not fasting, so I don't do fasting labs then.
Okay.
But the CRP, hemoglobin A1C.
Let's stop. Explain CRP.
Yeah.
CRP is called C-reactive protein. It was discovered decades ago. It's made by the liver, and it is released in response to inflammation. And we're gonna come back to this, and there's good inflammation, bad inflammation. But CRP can be elevated from an infection. You'd expect it to be elevated. But if you get a highly sensitive version, it can be elevated due to chronic inflammation. So that's why you would get that. All right, go on. What other blood tests would you get, Elizabeth?
I mentioned the hemoglobin A1C.
Hemoglobin A1C tells us our average blood sugars.
Right.
Right. They used to be really into glucose tolerance tests. You'd measure your blood sugar and maybe an insulin, drink some sugary stuff, and then take a blood every hour for the next 1 to 3 hours and give some idea. But this too is time consuming. You got to take a whole day off of work and whatnot. And you can get almost that amount of information from this hemoglobin A1C that gives us our average blood sugar. Does that sound right?
Yes, and it also shows the level of, it's a measure of glycation, which means, sugar sticking to proteins in your body, which is actually kind of one of these metabolic problems at the cellular level that kind of will decrease the functioning of your proteins. And some individuals may be more prone to glycation than others, but so one of my functional medicine courses said it's a marker of inflammation. It's a marker of dysfunction. Just if you have sugar molecules sticking to proteins. But I will say what I've noticed, hemoglobin A1C is one measure. Fasting blood sugar tells you something completely different. Glucose tolerance tells you something different. And a fasting insulin level and potentially insulin with each of those blood sugar, an hour and 2 hours.
Right.
There's a lot of different things you can tell about someone's metabolism. And one really, really interesting thing that I've found, there are some people that produce a ton of insulin and some people that don't. It's the people who produce a ton of insulin, or they have like a super pancreas, if you will, they tend to gain a lot of weight. They store it. Their body is protecting themselves from higher blood sugars. people who don't produce a lot of insulin, their pancreas isn't up to it, or they're gonna run out of insulin sooner. They tend to keep eating because they stay thin and they think they're fine and healthy, but their blood sugar may be going up. They just don't have the insulin to have them put on weight before they start to see sugar problems. And so there's like looking at different labs can tell you different things, and like a fasting blood sugar. I don't think my husband will mind if I talk about him personally, because I'm always on him. He doesn't have a very high insulin level at all. He's lean. He doesn't gain a lot of weight. So he gets away with, I think, eating a lot more than I would. But, it's his fasting blood sugar is creeping up. And that shows that overnight, that the way his liver and his pancreas and like trying to managing his blood sugar is getting a little harder. His body, probably doesn't quite have the insulin sensitivity to really manage things as well.
So you can have too little. Very interesting. So, oh boy, you've got so much to talk about here. Let's continue. What other blood tests might you get? Is there something that tells us about carbon metabolism?
Well, yeah, just a basic lipid profile.
Lipids in general are the things that carry fats around our bodies. One of the common fatty materials is cholesterol, but there's other things called triglycerides and other. They're all kind of lumped into lipids, so that's something you might test.
Correct, and right, if it's easy to do and it really doesn't cost any more money to go to Quest, would be to get the full NMR profile.
So these lipids could get broken down very precisely into their components.
Mm-hmm.
So you can get an NMR profile, lipid profile there. Do you ever check something called homocysteine?
Yes, or that's with my fasting labs. I'll check a fasting homocysteine. That can also be a marker of inflammation in the blood vessels and heart disease.
Mm-hmm.
And it's often associated with a very common single nuclear polymorphism, the MTHFR mutation, methyl tetrahydrofolate reductase deficiency.
You said it right.
Which we used to check it a lot with recurrent loss and or with pregnancy complications, and it was kind of like in vogue for a while, but then people would say, well, gosh, a quarter of the population has this. But when you start to look at what it does and how it helps, actually it works in lots of places in the body because it helps you transfer methyl groups around.
Right.
And that's been described as like the money exchange throughout the body. And it can affect depression, heart disease, cancer. Like there's so many places where it can be an issue. But so that's a reason that someone may have an elevated fasting homocysteine.
Gotcha.
And oftentimes you can, with replacement of B vitamins or methylated B vitamins, you can help bring that down.
So that's a lot of tests and a lot of things to talk about, Elizabeth. Now, do you ever I will back this up. One of the most valuable tests I had and one of the most disgusting tests I had was a stool test done at the urging of my chiropractor, Jeremy Maxwell. We've done a podcast with him, and I encourage our listeners to watch or listen to those. But it taught me so much. I had digestion issues. I had issues with the microbes in my gut. And treating that has had profound benefits on my health. And is that something you ever do? Or do you have our functional medicine colleagues, our chiropractors, our naturopaths do those tests for us or with us?
Right. I have not ventured into that testing. It actually, when I came home from my first functional medicine conference, that's what I wanted to do because I thought it was so profound. And, that I felt like I probably dealt with so many people who were having digestive issues and they all have to come get an ultrasound to make sure their ovaries okay,
Right.
But as far as working with somebody to correct those issues, I didn't feel as comfortable, and those tests are pretty darn expensive. And it's hard for me to encourage somebody to do a test that I may not be able to fully help them with.
And I don't think insurance pays for you.
Oh, right.
Right. Just
so
a wrinkle.
So another thing I've done is I've surrounded myself with, a network of people that actually do these things. One of them was Dr. McGarity that I mentioned earlier. There's actually a functional medicine nutritionist in Kansas City who graduated with my son from Rockbridge High School. And I think her first clinical rotation happened to be like in the functional medicine space. And I think she realized, wow, like this is where I can really make a difference. And she has her own private practice, which includes some of the stool testing. I mean, I think you can, I talk generally, I've got some handouts about gut health and, just making the case to people that this is something really important. And if you're constipated and not having, if you're having a lot of GI problems and GI complaints, this is probably some of the root cause of your other issues and probably really needs to be addressed. And but that it's not anything that I test right now.
Right now. But as you evolve, who knows where this is going to go.
Right.
So all these tests for all these different complaints, and so I just want to touch upon briefly, we can see that weight gain or weight loss doesn't tightly correlate with the calories or how much food you're eating.
A calorie is not a calorie.
A calorie is not a calorie. It's an oversimplification. I just say if we were a flame and we were burning a petrochemical, then maybe we could measure it very precisely how much goes in, how much is turned to heat. But we are not flames. They say, where's the flame? We're not. We are processing these energies, and it can go so many different ways.
Exactly.
You don't necessarily have to burn it all, and it gets shunted one way or the other. So this is very, very complicated. We're not pure thermodynamic systems, as that would oversimplify us. So that's a lot of tests, Elizabeth. And if this goes a long way, perhaps we'll break this conversation up into two pieces, because we could probably talk forever about this. So let's go back to some of these basic tests, these root cause tests. So you mentioned a thyroid panel. What tests are in a thyroid panel for you, if you want to go drill real deep?
Well, the TSH that you said we all check, or that everyone checks. And actually, I even think maybe the general cardiac experts say that probably having an optimal TSH is better for long-term heart health at this
That's right. Everyone agrees that a low thyroid screws up your cholesterol levels.
So,
make it simple.
So what I learned at that first functional medicine conference, which maybe I knew in the back of my brain but never really thought about, was how you have like two thyroid hormones. We call them T3 and T4, probably formal names, and they're not coming to the top of my head right now. But you have to convert the T4 to the T3, and the T3 is the active form.
Right.
And so the common medication that we use for thyroid is Synthroid.
It's T4.
It's T4. And so if somebody has an issue, high insulin or stress, could be two things that may slow the conversion of T4 to T3.
That's right.
Taking Synthroid may not be as effective for them as, say, a preparation that has both T3 and T4.
I believe inflammation in general I think there's 3 different enzymes that convert T4 to T3, and inflammation will hinder some of that activity. Yeah, so people argue, gee, maybe you should be getting some T3 with it if you're not feeling better.
And so so you can check a total T3 and T4, a free T3 and T4, and then there's something called a reverse T3 that sometimes that active T3 will turn into something that's not active. And so
the body can turn it down. If you're getting too much T4, or it's a person is starving or undernourished or whatnot, and they're cold because their metabolism is turning down, and rather than making a T3, they say, we don't want any more T3, and they'll reverse it so it won't be active.
Well, and then the thyroid antibodies has been a real game changer as well.
Tell me about those. We test them frequently.
So thyroid peroxidase antibodies, I think, are linked to reproductive issues, recurrent loss. Is that correct? Or
it goes back and forth. It's debatable. The safety valve is in some people.
Okay. Right. Well,
it may be a problem. And certainly TPO antibodies. There's these what are called thyroglobulin antibodies and these TPO antibodies. Almost everybody agrees that the TPO are the bad ones, the really bad ones that are connected to Hashimoto's condition. And so how do you integrate those thyroid antibody tests into your evaluation of the thyroid?
Well, to say, I think a lot of people recognize that TPO is specifically related to gluten intake and gluten sensitivity.
Really?
And so, and on a broader spectrum, why do you want antibodies? Or why do you want thyroglobulin antibodies either? I don't want any antibodies in my body to So, okay, that's going to kind of get us into gut health, leaky gut, and autoimmune disease, which is kind of a little different from metabolic health. But in putting the pieces together, if somebody has inflammatory conditions, a lot of GI complaints, their family history, there's GI issues or autoimmune issues, I think those thyroid antibodies are pretty key in telling us that, there's some inflammation at the gut level that probably needs to be addressed. And it might be as simple as taking gluten out of the diet or, lowering gluten intake. But like the people who do the stool test that we were talking about, they get a lot more information about the specific, microbiome that's there or certain, chemicals that might either protect or cause inflammation. So, so I'd say the thyroid tests, sometimes they help me, help sometimes people, if they're already on Synthroid, maybe they'd be a good candidate for that other medication with the T3. But I think knowing that the thyroid antibodies are there, I think in modern medicine, we have just a mantra, oh, well, you have autoimmune disease, it's always going to be there. But from a root cause medicine approach, you're going to say, wow, can we get rid of those antibodies? Can we stop the body from getting inflamed and angry? Because, that's just a marker. Who knows what else is getting past that leaky gut? There are plenty of other things that we're not testing for.
Yeah, and also I think, especially here in the Midwest where there are pesticides everywhere, we don't know it, that these pesticides may be leaking into our environment and possibly adding to this.
100%. Well, it's, yes, 100%. And the glyphosate that's in our food supply, they spray pesticides to get rid of the weeds before the food is harvested. And I think that there are some places where they measure glyphosate to see how much is in your blood. And everybody has some of it, but glyphosate is specifically, I think, toxic to that endothelial lining, the layer of the gut that's supposed to protect us. And the pesticides are also harmful to the microbes that are there to protect us because they're meant to kill plant. They don't bother human cells, but they bother all these other little cells that are in our intestine.
Oh, I didn't realize that. Oh my God, another connection. Now how I use the thyroid antibodies, and I think you know more than I do, and you're probably more sophisticated. But if I have someone who's
not by much,
as we learned to get grasshopper 1 and grasshopper 2, that if someone is coming in with one of these TSHs, optimum's probably between 1 and 2.5. Although you got to realize these are pulsatile hormones.
Sure.
They change 20 to 30% throughout the day. But if we're looking at rough numbers, if someone is struggling with their weight a little bit and their TSH is in this high normal range, I use a TPO. If they have positive antibodies, that tells me that they've got an autoimmune condition with their thyroid. These things come and go, and they can come and go over the course of months. It says that I should be a little more serious about replacement. Basic thyroid hormones are generally pretty cheap in the scheme of things. Low doses are fairly safe. You're not going to kill somebody.
There's a big cushion of that TSH that you can kind of play with. But
And whether you choose to give the synthetic Synthroid T4 or one of these nature thyroids or one of these animal product thyroids that has some T3 in it, unless somebody has a very fragile heart or they've got some other problems, you're not going to risk anybody's life, particularly with low-dose thyroids. And you may be blunting these excursions at times when you're not testing them. So I have a lower threshold to treat, at least in the infertility world, when I see these antibodies.
Yeah.
That's how I use them. Although I'm not sophisticated enough to bring in these leaky gut issues that.
Well, and I'm not qualified to totally help someone fix a leaky gut. actually, I don't think any MDs are really do, except for maybe my friend Dree McGarity here in Columbia, Missouri, but like, or MDs in Columbia, I was meaning,
Sure.
but just like to open patients' ideas to the possibility of why something is happening. Patients always want to know why. Why is my body doing this? Why am I feeling this way? Like, what is happening? And so I think patients are genuinely curious, and they, a lot of times there are a lot of blogs and a lot of books and a lot of information that patients will get their hands on, and they can, figure out some things for themselves potentially.
And then the quality of this information is highly variable. I mean, some of it might be good information and some of it might be terrible. And how do you do if you're getting it free on the internet, Well, I get this all the time. Well, I watched this YouTube video and blah, blah, blah. And it's from somebody that knows, what I like to say, knows just enough to be dangerous.
Well, right. And if somebody's trying to sell you something or sell you the perfect supplement that's going to fix everything, that might be a little suspicious. But I think when people are learning about their environment, when they're learning about what they're eating, when they're learning about the food supply, when they're learning about the agricultural system, and they're starting to realize all the things that are coming into their body and all the different places that can affect them, that's good. I mean, they can only, hopefully they'll use that information to take care of themselves better in ways that aren't drugs,
I don't think anyone's out there saying eat more pesticides.
Okay, right. right.
Do you have any feelings on iodine in food? I know very little. All I know is if you get salt that has iodine in it, and I eat occasional sushi and I get some kelp in there, which is high in iodine. Do you ever use iodine itself? I know very little about that.
It's funny that you would ask that because when we started our hormone replacement, sort of our pellet therapy, the company that we went with had an iodine replacement or supplement, kind of promoted for breast health and thyroid health.
Right. And there's molecular iodine, in fact, may help fibrocystic condition.
So that is something that in our panel, we check it in the blood, and most people are fine, some people are low, but people on a supplement tend to be sky high on it.
Right.
And it's so funny that you'd say that. I just made an appointment to go see Dr. Beverly Miles, who's a chiropractor here in town, because I wanted to, I know, she's been sort of practicing root cause medicine for years and years and years and years and years. And I reached out to her specifically on that subject because I feel like that's a kind of a hole in one of the holes in my knowledge.
Yeah. So you can take high dose iodine to shut down the thyroid gland. So if a nuclear bomb goes off and there's radioactive iodine in the atmosphere, it's one way to temporarily shut off your thyroid. And certainly areas of the world that have low iodine have their own thyroid issues and goiters. But those of us who get average amounts of iodine doesn't seem to be that big of a deal.
Well, in my thyroid lecture, where I kind of felt like I gained a better understanding and I came home and started checking thyroid more, like what we were just talking about, one of the first things that was recommended was not to necessarily give thyroid medication, but to make sure they were getting enough of the right supplements, including selenium, iodine, I think vitamin C and E, iron if a woman is menstruating.
Right.
But, kind of like zinc. And these are like they're kind of like the same things you use for skin and hair potentially.
Isn't that interesting?
But in fact, I think we had a common patient one time who was struggling with thyroid issues, and I was sharing with her the list of supplements for thyroid. Like they would suggest start these supplements before starting a thyroid medication, maybe check it in 3 months.
Yeah,
and then maybe recheck the thyroid, that thyroid panel. And anyway, she had just ordered the Nutrafol, that supplement for hair that, is advertised quite a bit. And we were looking at the ingredients. The Nutrafol matched exactly kind of what was recommended for just, boosting thyroid function. So that was fairly interesting.
Yeah, these requires, because these are clearly necessary nutrients. Absolutely. So you're going to have multiple downstream benefits.
But I will get back to you with more information on iodine because that's on my list.
It's on my list too. I don't know enough about it. So you would get a hemoglobin A1C, and you'd also draw a fasting blood sugar, a glucose, and an insulin, maybe?
Depending on how the labs come back with the non-fasting labs, I might say, inflammation's up. Let's check these fasting labs. Usually people want more information. And so I like to look at all of them. And
so are the inflammation markers maybe the next thing you'd look at? I want to get some idea of your logic here.
At a first visit, I'll get what I can get not fasting.
Okay.
And I'll be honest, I modeled this after what Mark Hyman sent out an email a while ago on the tests that he recommended patients get every year. And so that was, I think what I just mentioned, the thyroid panel with the antibodies, high sensitivity C-reactive protein, so an inflammation test, a hemoglobin A1C, a lipid panel, and then probably a CMP and a CBC.
Okay, CMP is a metabolic panel that looks at the salts in your blood, but it also gives you a peek at how good your kidneys are functioning and how good your liver is functioning and your bones to a degree.
Correct. And interestingly, the liver test, you talk about the bell-shaped curve. Apparently, and I get this from Dr. Lustig in Metabolical, that at one time, liver tests were all thought to be less than they are now, like 25 or less. But because with the health of our nation, like liver tests have been increasing, kind of with the increase of fatty liver potentially.
Right.
And so if you're looking at liver tests, or specifically the AST, you really want it to be in the lower half, not just barely normal.
Right. So normal change. As more and more sick people drag the curve up.
Yes.
You want to remember, we want to be down near the normal. And once again, I don't know Robert Lustig. I have no financial interest with him, but I've enjoyed Robert Lustig for many years. He's been a groundbreaker in so many different things around diet and carbohydrates and sugar and weight gain and stuff. He's at University of California, San Francisco.
And he's a pediatric endocrinologist.
Yes, he is.
And so, he comes at it from kind of watching the childhood obesity epidemic kind of evolve, because I think he started practice maybe in the 80s.
Yes, he's been a thought leader in childhood obesity for a long time. So that's a good one. So have you read Metabolical there?
Just recently, yes.
You just
yes,
read it.
And a couple of my colleagues have read it as well, and it's kind of it's really comprehensive, but very, very good.
Good. We'll put a link on that about that in the description below. So we've got these inflammation markers, and so let's talk about this high sensitivity CRP. CRP, you can just measure a plain old CRP, and it's good up to way high levels. And if you have somebody with a sepsis, which is bacteria in the blood, a raging infection, you're going to see very, very high levels of CRP. But I believe they developed this high sensitivity CRP, so you can really look at it when it's low, when it's below 3. And I believe you want a CRP below 1. What do you think about that?
Right. That's the lab reads out as if like for risk of heart disease, and they say less than 1 is what you want, 1 to 2 is medium risk, or maybe 1 to 3 is medium risk, and then over 3 is high risk. So, some people say just the lower the better. Or some of the metabolic experts at Levels Health would say like maybe a goal of less than 0.5 is even
okay. So
better.
That's where you need the high sensitivity, because 0.5 is different from 0.9.
And it's a very this is one of those tests, back in medical school and residency, you kind of were taught, well, don't check a test if you don't know what to do with it. Or like if you don't have a treatment for it.
Right, if it's not going to change your management.
Right, or if you don't have a drug to prescribe for it.
Right.
But again, in this more of a root cause medicine approach, or getting patients curious about what's happening in their own body. And the thing is, this may be different for every person. So in part of what I do with these initial labs, I think I mentioned I have like a cover letter that I send. And so I have a podcast from Dr. Mark Hyman on inflammation. And actually there's a good blog on the Levels Health .com. There's a website, and have I mentioned Levels Health yet by any chance? So this is a website kind of dedicated to metabolic health. The business model is they help people with their glucose monitoring and allow people to use continuous glucose monitors, like even if they're not diabetic.
Really?
Yes. And that sounds a little, some people think, well, is that making people a little too focused on one thing and missing the big picture? But the point is, people all respond differently to different things. But so they have a good blog on what is high sensitivity C-reactive protein and what does it mean. And their take is the lower the better. The lower you can get it, the better. And so then they go through, different things that cause inflammation. Mark Hyman puts it into 3 categories, which is kind of easy to think about. He thinks just about diet in general. You can have an inflammatory diet, a lot of, processed foods with, modern ingredients or the processed food oils. And this sounds like diet, but it's not diet. It's kind of like gut health, which goes more into somebody, say, that maybe has leaky gut or dysbiosis, or somebody who actually has a gut health problem, or someone who tends toward autoimmune disease. There might be something kind of, very specific about the makeup of their gut that's allowing them to have more inflammation. And then this is getting into, you're gonna think I'm getting kind of crazy, but your thoughts and like your stress, essentially,
right?
And that linking the hormones, if stress is causing high cortisol, that's something that can drive inflammation in various ways as well. So that's kind of like 3 buckets to think about inflammation in. And I actually, when I started checking that test, I'm like, oh, how am I going to explain this to people? I found a diagram, and there were a few other things that were in there, and one was like pesticides and chemicals, or like being toxic on things, or and these are things that functional medicine doctors test for that I don't, like heavy metals, mercury poisoning.
Oh, that's a whole nother
like
world.
That. Then in the chronic tick infections like Lyme disease.
That's growing.
Is something that could potentially be a source of inflammation that you don't know about. And then obesity in and of itself, which is what Barry Sears' book is about, toxic fat, is that, and this is probably primarily people who have that super pancreas who produce tons of insulin, and they tend to put on weight in their abdomen.
Right.
That fat can get very inflammatory. It can, they describe it as it becomes its own organ that produces inflammation.
Yeah, let's just talk about that real briefly. There's the fat under our skin and around our body. Then there's the fat around our guts, in our bellies. You see a protruding gut, that's not necessarily fat under the skin, that's fat around the bowels. And I've been a big fan of Barry Sears over the years. Once again, I don't know.
The Zone diet long ago.
Zone. He doesn't know me. I don't know him, but I've admired his work for many, many years. So Barry Sears, another person to look at his body of work.
Well, and Dr. Kroll is a retired plastic surgeon here in town. I can't remember
Greg
where
Kroll?
I was. Yes,
I
ran into him. We were at some party at the same time, and we started talking about the stuff in general. And he said A Week in the Zone, which is a book that he wrote.
The Barry Sears wrote.
Yes, yeah, and he was like, it's the best. It's like, that's great for patients. A Week in the Zone. So there's obviously millions of places people can get their information, and so I feel like I keep trying to find more places where people can get information, and based on the labs that I check, I hope I can pique their interest in a certain thing or source, or if that makes any sense.
Absolutely. So if the CRP is elevated, it doesn't tell you exactly what the problem is.
That's the problem.
It casts a wide net, lets you know there's probably something tweaking you, and everyone's a little different. So
right.
There's probably no ideal diet for every person, because people are different.
Exactly.
Like your ethnicity, your age, your body type,
your microbiome,
your history, your microbiome. So what may be good for Mary may not be good for Sally, and what might be good for Gil may not be good for Hunter. So So we have to avoid these blanket statements too.
For sure.
And as we age and as our biome changes, you might be able to tolerate. Once you get healthy, you can tolerate a little bit of junk here and there, right? It doesn't make as much difference.
But I think at midlife our microbiome changes and probably becomes less diverse, less healthy, just from a lifetime of the modern American diet, or the like all the things that are in our food, the processed food, you kind of go through life at a younger age, not putting on weight, eating whatever you want.
Right.
And that, in the meantime, is probably decimating our microbiome. And so at like midlife, there's a lot of things that happen all at once, and it's a lot.
I'll never forget when I turned 30. I was always a lean, athletic guy. I could eat whatever I want. When I turned 30, one bite of a donut would go straight to my hiney. All of a sudden, what happened here? It went right from my butt. I noticed it was a huge change. All right, so I don't even know where to go from here. So you would also add a lipid test. Now, these cholesterol levels. I'm going to be doing some podcasts with some people that know an awful lot about this, and a lot of people believe that these lipid levels have been overblown, and have been.
Have you looked at like the hazard ratio or mortality rate
all
compared
of this stuff.
to
Yeah.
like
So
cholesterol levels?
Yeah. So I just want to briefly touch upon this here. Cholesterol is a vital part of us. It's shunted around the body with different ways it needs to be. A lot of emphasis has been placed on this LDL fraction, or this part of the cholesterol. I've even heard it referred to as poo, as something horrible within our bodies. But if you look at this poo and you look at levels of this LDL, turns out if you have low levels, if you look at all the reasons for dying, you die really. Your chance of dying,
cancer and infection,
in fact,
and immune problems.
This is not poo. It wouldn't be there if it weren't important and good for us.
Well, I guess that's where. So suddenly, when I realized that your cholesterol number was a weight, it wasn't a number. It was the weight of your cholesterol. So if you have a cholesterol of 200, it weighs 200. Now, do you have a bunch of small little particles that weigh 200, or do you have more big fluffy particles that weigh 200? And
that's a good way to think about it. I like that.
So the small particles tend to be more inflammatory, and they tend to dig into the intima, or into the endothelial lining of the vessels more. I draw this out for my patients, but you know what can tell you so you could do the NMR particles where you actually have that figured out. They can tell you what your big
because those
fluffy
are
particles
not measured in your standard cholesterol panel. That are not measured, the sizes.
But your triglyceride to HDL ratio is a very good marker of that.
Right. So
if you ideally, this is I can bring out my metabolic cheat sheet now, or
sure.
What I explain is potentially perfect metabolic health. And then what we do describe in the medical literature is metabolic syndrome, when people have actually these top criteria is what will define metabolic syndrome. We could talk about that later. But an ideal triglyceride to HDL ratio is going to be 1.
Yeah,
if you can actually get your triglycerides and your HDL to match, that's a very good sign that
your particle sizes are favorable.
Yes.
Yeah.
And at least also insulin resistance, which goes along with that.
Right.
How your body is processing sugar, because, well, tell me, and I've thought about this so much. So if you're sending lots of sugar to your liver, but your body can't really use it, your body breaks down that sugar and creates, or that, creates fat from sugar, or de novo lipogenesis in the liver. So you create these little fat particles, and that's kind of where you get more triglycerides from, or one way that your triglycerides go up.
Exactly.
And so, they kind of have to make more of these particles, and then when they release the fat, they become small and dense. And so it kind of has to do with, how the liver is processing everything that's coming from your stomach, and a lot of it is sugar driven.
Yeah.
Or carbohydrate driven, starch driven.
Yeah, and I remember when I was younger, there was a company, or at least there's companies that thought, well, you should give fructose, and there were these fructose sweeteners. So instead of having a sugar packet, it was of sucrose, which is a glucose and a fructose stuck together. It was pure fructose because they thought, hey, it doesn't raise your insulin as much. Maybe it's a little sweeter. You end up eating fewer calories, and it's good for you. But it turns out that fructose, it cannot be metabolized in the rest of the body. It has to be done by the liver, which goes straight into these triglycerides and makes your liver fat.
Stresses your liver immensely.
Stresses your liver immensely. So what they thought was real good in a real simplistic way, in fact, was not good for you at all. So I won't talk about lipids much more other than to say absolute numbers. Like I see this all the time. Someone has had a lipid panel and their cholesterol is 201, right? And anything they want you to be less than 200. So the computer stamps an H in red. 201, there's an H by it. Most doctors, particularly primary care doctors, freak out. Say you've got high cholesterol, you need to start a statin, without any appreciation for these other fractions. I see this all the time. The HDL's high, triglycerides are double digits, they're low, and this total cholesterol is absolutely meaningless.
Well, and there's some other markers in that NMR panel that you can look at, like there's a pattern A and a pattern B. Like I think they kind of look at, and I'm sorry, I don't know exactly how they determine it, but they kind of see the sizes and the numbers, and they can kind of say you're more of a pattern A or B, and A is good and B is not good. Right. There's also something, ApoB, which is a marker of, I don't know if it's LDL or, but it's like the number of ApoB particles is another good marker, and that's Peter Attia. He's a guy who's into longevity.
I maybe we'll interview him someday. Yeah.
Oh, that would be fascinating because I've probably learned the most about lipids from following his podcast, actually.
Yes.
And I personally have lipoprotein little a, which, do you know what that is?
Well, not as much as you.
Okay. Well, so it's a genetic variant. It's your body produces this apoprotein that attaches to your cholesterol molecules.
Yeah, it's this thing. It encompasses this packet.
So I have more inflammatory little particles based on this thing that my body produces. So like
your genetics
right,
you were born with.
Right. And I had all babies that were over 9 pounds. My brother was 10.5 pounds. I guess in the past it kept you from dying of shock or maybe dying in childbirth. I don't know. Maybe that's why.
It had a benefit, correct?
But so there's not a lot you can do about it, but control all the other things that are going on, all the other forms of inflammation in your body. So that's people that have a strong family history of heart disease. That's an interesting piece of information. Again, there's not a lot of therapies for it, but it's really motivating to not be a borderline diabetic or to not let my inflammation level get too high and to try and keep my other particles as in as good a shape as I can. You can also measure an oxidized LDL to see how inflamed those LDL particles are. So, but so I think that the idea of thinking about heart disease as inflammation kind of makes more sense and encompasses way more ideas, more strategies, even more tests to judge your risk.
Yeah. There's a common misconception that clogged arteries is due to these fats sticking on the inside. Mm-hmm. It's like I have hard water in my house, and the calcium builds up and clogs them up from the inside out. But that's not what atherosclerosis is.
But it's easy to think about. It's very satisfying, and it just, people want easy answers. And so that was a very easy thing to kind of, you know.
Right, but it's completely wrong.
Okay.
It's not things sticking on the inside, folks.
Right.
It's stuff eating into the wall of your uterus. Here's the reproductive doctor.
Right.
Into the walls of the
arteries.
intima of your arteries, and then they expand because this stuff is growing on the inside in the walls of the artery, and then pushing in, and then it can break off and whatnot. So there's controversy about ApoB protein and whatnot, and I think that's still getting worked out. So let's briefly talk about what I think we're going to do, Elizabeth. Let's talk about these blood sugar tests, and then we will call that episode 1. And we're going to come back and talk about what we actually do about these tests, because it's taken us almost an hour just to get through the tests that you order. And this is just such a wealth of information and stuff to unpack. So you had mentioned that in addition to a hemoglobin A1C, which gives us maybe more of an average, that you will sometimes get a fasting sugar, sometimes get a fasting insulin, and sometimes do a glucose tolerance test.
Right. Well, and I've really never done a glucose tolerance test on anybody other than my husband. or a postpartum patient, because that's what's recommended. But the funny story, when we went to Quest, I really wanted to get the corresponding insulin levels with his glucose tolerance test, because that gives you another level of information, you know, how hard the pancreas is working to try to keep up with the sugar elevations.
Right.
And somehow, you know, I was just writing it on the bottom of my Quest form. I write all these extra things because they're not on their usual tests.
And I'll draw little smiley faces,
yes,
and frowny faces. Yeah.
I really ticked off the person who was there to draw the blood, because I was there with him, and I went back to kind of explain what a lot of the tests were. And, you know, we were all kind of laughing about it at first, but I told him, I was like, when you go in to do your sugar test, please make sure they do your insulin levels with you, or with that.
Right.
And for some reason, I mean, I didn't have the right code for what that needed to be. I've since figured it out, or I didn't have the number, because there's a special number when you're doing it with a glucose tolerance test, and all that I had was a fasting insulin. And I could tell I was just annoying this person. And I was like, it's so easy. I mean, it seemed very easy to me, but it didn't seem easy to them. And my husband was like, I'm never doing this test again. So if you don't get this figured out, but I would be really curious but again, I don't think he produces a lot of insulin. I think his body's dealing with a lot of sugar in different ways. And anyway, one of the sources that now I actually give it to patients, even if I'm not sometimes running labs on them, if they're briefly complaining to me, and I know they're doing labs with their primary doctor, I refer them to levelshealth.com, you know, how to interpret your cholesterol and metabolic health tests. So it goes through, I should pull it up, but they explain like what normal is, but why ideal is ideal. And so on the fasting blood sugar, they say, you know, it kind of tells how your body's doing with sugar throughout the night when you don't have food, like how insulin and glucagon are kind of doing their thing while you're sleeping.
Right.
And so if your insulin's starting to not work so well, you might have a higher blood sugar in the morning. Like obviously you need to have some sugar, so you're throughout the night, your liver will produce a little glucose, but like the ability to regulate that gets lost as, you know, as you get a little closer towards diabetes. I mean, if you think about it, the fact that we don't die after every meal is pretty amazing, right?
I love it.
I mean, I can't claim that as original, but like our body is fantastic in the fact that we can throw all this stuff in it, go about our day, and it figures out how to keep our blood sugar in this pretty narrow range.
Yes.
And I mean, we really abuse that system. And then, you know, the food industry has just accelerated that, I think, without people really knowing what they're doing.
Yeah, the chemists know exactly what'll keep you biting it again, taking another bite and taking another bite. They've got all the mouth feel, the texture, the sweetness, the salty, the all that stuff. They've got it figured out quite well.
All that.
Yeah, so I have some friends in New York, Keith and Valerie Bernstein. I know Keith has been doing these 5-hour glucose tolerance tests for years. I'm going to have him on sometime and see what he can tell me about this. So I'll just say that there are people that can get information from that, and we will talk to the experts about that. So,
well, and the point I think of these functional medicine doctors are, if you start to see this dysfunction, it's probably easier to try and turn it around at this point, than in a typical medical doctor's office. It's like, oh, you're not pre-diabetic yet. We'll just watch it. We'll just, you're not quite there yet. You're not quite diabetic.
Not sick enough.
So instead of like starting the diet to prevent prediabetes, you kind of wait till someone's pre-diabetic. And then how aggressive are we at really trying to reverse the disease, and how often do we just go ahead and go to medications?
Right. I don't know if you've been watching TV recently, but these GLP-1 inhibitors, all these new medicines for type 2 diabetes and weight loss, they're just taking off. And nowhere is it mentioned, well, gee, if you stopped eating, blah, 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 you wouldn't need this medicine. So you mentioned something earlier that they're waiting till a problem is druggable, whereas you can deal with them, or with the right information, people can deal with them while they are foodable.
And that's from Dr. Lustig in Metabolical. Yeah. He says that the chronic diseases are not druggable. They just they get worse. Even though we drug them, they get worse. All the medications for diabetes, especially when you slide on into using insulin, then you're just kind of adding fuel to the fire by putting more insulin in your body and shoving more sugar in your cells. So it's just a different way. It's that root cause mindset, it's just
mindset.
Yeah.
And it's interesting. These medicines are touted. There's even clinics sprouting up where all they do is they give these new diabetes medicines for weight loss specifically. For a while they were HCG. People would, 5-10 years ago, these HCG clinics were popping up. HCG is pregnancy hormone. It's a controlled substance. We use it a lot in the fertility world, but people were giving it chronically for weight loss. And it was debatable whether you lost any or not. Some people lost a little bit. But these diabetes medicines, these injections and some of the pills are in fact causing measurable, dependable weight loss. And clinics are popping up just to give those medicines. So they don't say, you have to change how you eat necessarily. We'll just give you this medicine and there's 15 pounds.
I've heard it's described a little bit as a medical
Atkins.
Or even gastric bypass surgery, because it slows down your gut so you're not as, it reduces your intake because you're not as hungry.
Right.
And then it works on those hormones. It's a glucagon-like inhibitor, or a glucagon-like agonist. I'm sorry, it's an agonist. So it's the antagonist to insulin. So, and I did see one of my patients had lost a bunch of weight from the last year, and I asked her, I was like, oh my gosh, what, I always ask people what they do when they lose weight, because it's like, you just want to know. And she had been on one of those medications, and she could only get it for about 2 months, and then she had a hard time getting it. And it helped her drop weight initially, and then it just stayed off, which a lot of the stories around those medications are that once you're on them for life. But I wonder if in the right person, or if somebody who, I think the higher your insulin level is, the higher your fasting insulin level is, if it's up, in the teens and 20s, the more it could give you that nudge to just maybe kind of start to reverse things. And that maybe if that insulin level came down somewhat, doing the right behaviors would be easier or more successful. That case particularly made me think, well, maybe but the idea of starting a lot of people on them without really getting to the root of the problem, which is really our food industry. And I mean, it's our whole culture. So Casey Means is who I first heard about. She started levelshealth.com, and she's been on several podcasts, but she was a few months away from finishing her ENT residency, and she was like, this system is like so bad, so inefficient.
Did she quit?
She got out, yeah.
She got out. She didn't finish.
She was saying, here's one patient with, all of these problems, and they go to all of these specialists, and like no one's really coordinating the root cause of all these problems. And so she's kind of the brains behind the Levels Health, and that was the company that allows people to rent continuous glucose monitors if they want to. And it's kind of twofold, because they're collecting data on the food industry as they do it. Because as people go to Chipotle, they can tell you, if you have a salad, no rice, no burrito, your blood sugar levels are pretty stable. But if you add these things, if you have beans and rice and a huge tortilla,
Right.
your blood spike is really huge. And with all the fast food industry and just the food industry in general, you can go to their site and see like what foods are bad, what foods are good.
Oh, so they have profiles,
and so,
sugar profiles after all these different meals.
Yes, yeah,
With real people.
Right. So they're so they've got a lot of things going there. And then her brother somehow, he's been making waves. He's been on a lot of shows recently, but he started a company called True Med so that people could actually use their healthcare dollars or cafeteria money like for food. He thinks that investing money in food would be, a much better investment. And I agree. And so he's trying to raise awareness. And so he and Casey, I think they're writing a book together, and they were discussing, there are all these diet wars. There's the
Right.
paleo people and the carnivore people and the vegan people. And they're like, really they're all eating nutrient dense foods that lower inflammation. Like they're all kind of talking about a lot of the same things as far as getting a lot of the junk out of our diet.
Yeah, that's job number one. Now, we haven't talked about testing the adrenal glands.
Oh, yes.
And I know. And let me just explain to people listening and watching.
Oh, you're the endocrinologist, right?
Well,
I could pick your brain about this.
The adrenal gland goes up and down throughout the day.
Yeah.
Right? And a random cortisol, which comes from the adrenal gland, one from the part of the adrenal gland that influences sugar and inflammation and whatnot, has such a wide variation that a random test is almost meaningless unless it's incredibly low or incredibly high.
So have you ever done anything with salivary tests throughout the day to establish the cortisol curve?
The only salivary test that I'm aware of that is validated and approved for diagnostic is a salivary test at night. It's one of the two tests you can do to see if someone is making too much and has a Cushing's disease or a Cushing's syndrome type of thing. That is the only salivary cortisol that I believe is recognized as being reflective of what's going on and reproducible. Other than that, all these other salivary tests and profiles are very controversial because they're so variable, and the true meaning and how do you interpret them. Like I see people with these salivary tests and have all these different steroids along the pathways that are tested and whatnot, but I don't know how much you can actually get out of that information to make a meaningful change or come up with a meaningful therapeutic regimen.
Well, I would love for you to interview like a functional medicine doctor, a real functional medicine doctor.
Oh, they love it.
Because,
they think that most of them think it's the the second coming of lab testing, and a lot of them I think really grossly overestimate what they can tell from these tests. But I'm open. I'm open to data and suggestion.
From all the courses that I've went to, or that I've gone to, a lot of people, can only see patients if they'll do that test so they can understand how their adrenals are functioning. Some people are very high cortisol, some people are low cortisol, and neither of those work very well.
Right, I think
And
we can
so
all agree to that.
This may be another thing is maybe it hasn't been studied because there's not really a drug you give somebody to fix the adrenals.
It's not druggable.
It's a lot about sleep and stress and possibly nutrition. And when you get information from somebody about their adrenal glands throughout the day and you say, look, most people that are healthy tend to make more cortisol in the morning, and then it drops during the day, and then it comes up a little at night, and it usually, but yours is all over the place, or yours is high up here, or you have nothing. I guess maybe it just makes somebody think, wow, there's something in my body that isn't ideally. No, I don't have Addison's disease, and no, I don't have Cushing's disease. But if you kind of start to understand that cortisol is important, and it is important throughout the day.
Everyone will agree to that.
That you're actually, I'm going to say they're using that to help people buy into the lifestyle piece of what they need to do to get themselves better.
Yeah, my feeling is kind of it's still in its infancy, even though you've got all these salivary tests and these profiles going on. The only recognized test that I've ever done for adrenal is true adrenal insufficiency, where you measure a morning cortisol level, you give a stimulatory hormone called ACTH or cortisol, and then you measure, does it go up in an hour or two sufficiently? And if it doesn't hit 17 or 20, whatever your cutoff is, well, then you said, hey, this is an adrenal gland that's not working properly. Right. It's kind of like thyroid and the old-fashioned TSH. Once it was so bad, so elevated that you had a low, everyone would agree, well, this is a low-acting thyroid. Well, there is that test for the adrenal gland. But obviously, there's gray areas here. There's degrees of dysfunction. And even though someone, I'll do a stimulation test, and once again, I don't do them very often, that is technically normal, or they eke out a 17.5 or whatever. Is that really an optimal adrenal gland? And I don't know how to test for that, or necessarily how you can drug that other than to give. And another thing I need to explain to people, if you give cortisol or drugs in this family, prednisones or dexamethasones and whatnot, you say, oh, you replaced the problem. But now you suppressed the brain, and now the adrenal glands shut down. And so you haven't really helped them.
No.
You haven't helped them at all. And so you've got these taper offs and all these things that.
And I'm going to say this is also where you'll find, I think there are studies on things like meditation and yoga and deep breathing. We have had a
podcast that's Dr. What was his name? David McLaren. We had David McLaren here. We have a wonderful podcast on transcendental meditation where he talks about measurable objective benefits of TM.
I'll bet he has some good studies with cortisol
curves I think he throughout did. He the had day. A whole book of data, and I think cortisol is one of the things they measured.
But I think rather than a single cortisol test at a random time during the day, the cortisol curve is more what people want to see. It's not like just what are you in the morning, what are you in the evening,
right?
Like what does your graph show throughout the day. And the beautiful thing is that we're not going to give you steroids or these things to fix it. You're going to give your body what it needs by, if you can't change your stressful job, potentially deep breathing or yoga or meditation could literally help you change. And I have seen I can't come up with one, but in all of these courses, looking at the pieces that these doctors put together for patients, that's a part of it. And that their cortisol curves do improve when they do all of the things, but a lot of it is lifestyle and taking care of yourself. And potentially not over-exercising.
Right. Well, Elizabeth, I think that is a perfect way to end part one of this discussion. We've talked about all these various blood tests you can get to look at metabolic health and optimum health. And in our next half, I would like to talk about getting these tests and what do you do about it. Will you come back and talk to me for a few more minutes and talk about what you actually do about these issues?
Well, Yes, although that will be short because I
well,
I think I
I'll
told
flesh
you
it out.
that
I'll help
right.
flesh it out.
Okay,
Elizabeth.
right. Because these are what I've discovered in doing all this and in learning and in checking more tests is it's not a lot about what I do, but it's what I inspire somebody else to do for themselves, for
I'd like-
herself, for
I'd
him or
like-
herself, or themselves.
I'd like to talk about that too. Well, thank you, Elizabeth, very much for an overview of testing for metabolic health, and we will unpack this some more in our next edition.
It was fun.
Thank you,
Thanks.
Elizabeth.